Hi, I'm Dr. Kelly Starrett with the Ready State. Today we are talking about good old-fashioned runner's knee or jumper's knee. Oftentimes, it doesn't matter if I'm not a runner or a jumper, but I've got some pain right here under my patella or in and around the kneecap. Now, whenever this happens, especially when I have young people or young athletes, the same rules apply to older athletes as well. But one of our chief goals is to get some relief. I mean, I think that's one of the things that we're sort of disingenuous about in terms of when we're thinking about managing congestion or trying to improve someone's function is, hey, I just need this thing to stop hurting. One of the great things about having an H-wave as part of your athletic repertoire is that it allows us to have access to what we call on-demand pain relief. So in this situation, I've got the gray lead just on either side of this patellar tendon. And we're going to call it a tendon, but really it's a ligament because it goes from bone to bone. But right here is the spot that kind of gets hot and sensitized. And one of the things that I can do is I can go to high frequency and I can dial this high frequency up until I get a comfortable buzzing, kind of a numbing situation. What's happening here is that now I'm interfering with how my brain is perceiving this, but unlike traditional kind of crappy over-the-counter TENS units, what's actually happening here is I'm able to fatigue some of the sensory aspects of this tissue, and what it means is that I can shut that down, that sort of response to my brain being generated here, and my brain can now interpret this as pain-free, which means I can run this for 45 minutes to an hour, feel great, and then have many minutes afterwards, sometimes many hours of pain-free relief. So it's important that as we're thinking through pain problems, we want to desensitize something. We want to go ahead and just hurry up and give someone some relief. But the problem with that, potentially, is it doesn't allow us necessarily to restore function. Now, if I'm feeling like I have less discomfort, I'm certainly going to be more apt to move and want to load, and that's a wonderful way to manage this. So let's say I have a sore knee, but I'm trying to get my steps in to help congest and load the tissues. I might be able to use high frequency and then have a window of opportunity where I can move more. That's a great use of it. The second piece of the puzzle is decongestion. And when I mean decongestion is oftentimes we've got a tissue system that hasn't effectively evacuated some of the fluids or some of the waste processes or normal biologic processes through the lymphatic system out of that tissue area. And what ends up happening is that all of those drains, all those sewage systems of the body are actually driven by muscle contraction. In fact, when I have swelling in and around a joint, the joint is actually drained by the deep sewers of the body, these deep lymphatic systems. So what I can do here is I can give myself some pain relief, which is great, but then I can push the black lead here onto low, and what I'm going to do is just dial this up until I get a comfortable contraction in a tissue system either directly above or directly below this area I'm trying to target. In this situation, it's so easy to put the pads on and move them around until I get a really solid muscle contraction. And what happens now is that I can actually start to decongest. And what's interesting about that is that when I begin to remove waste fluids and the normal biologic processes by squeezing the muscles which dump the sewers, I end up removing what we think is a sort of a rate-limiting process, that when I'm swollen, I actually can't get the kind of blood flow into the tissues that I want. So I need to take the garbage out, and then simultaneously, that'll help initiate bringing the groceries in. So if I've got an irritated tendon or a tendinopathy, or I've loaded, or I've just gone for a big run or played squash or pickleball, and now suddenly I'm at my desk, what's happening here is that I may be becoming sensitized because I'm having swelling in the area. And being able to manage that congestion effortlessly, easily, is really a shortcut hack to being able to stay ahead of volume and not have what we call these adaptation errors, which means I'm not adapting to the intense exercise or movement that I just did. So in this situation, with a single device, I've got some immediate on-demand pain relief, but I've also got some non-fatiguing muscle contraction that I can run safely and comfortably for many hours, ideally in the morning, maybe a little bit at lunch, maybe in the evening, or if it's not such a big deal, I could pump 20 out of 24 hours a day. I could even sleep with this on, decongest and sort of respawn the system. The bottom line is we always want to take at least a two-part approach to managing and thinking about a sensitized area? One, can I get some relief? And number, so I can load it and just kind of feel less of a threat. And number two, can I think about removing waste and improving blood flow? And the H-Wave is your secret weapon.